Okay, so hello everyone to a new episode of the Adoption and Fostering Journal podcast. And I'm absolutely delighted to have not one, but two guests with me today. We have Peter Unwin and Becki Meakin, who together with others authored the article in our current issue, Looking Past the Stereotypes, Disabled People as Foster Carers. So could you two please introduce yourself to our listeners? If we start with you, Peter.
Yeah, hi everybody. My name is Peter Unwin. I'm a principal lecturer at the University of Worcester, and my background is I've been a foster carer, I've been a senior manager, I've been a chair of a range of foster panels, I'm on an adoption panel, and I'm pleased to be asked to be part of this podcast.
Thank you. Hi, I'm Becki Meakin, as I'm a disabled woman. I'm also a researcher, currently research manager for an organisation called Luminous.
Lovely. And without spoilers, your article suggests a solution to a problem that foster care in England is facing. Could you outline the problem for us?
Well, the problem is really one of recruitment from the point of view of children who aren't given enough choice in terms of locality or perhaps specialism or fit match culturally. And not only is this issue of recruitment a burning issue and has been for some decades, but there's the issue of disabled people, of whom there are millions in the country. Often their parents themselves don't seem to have any profile, hardly any profile at all within fostering. It seems a great missed opportunity to recruit people with lots of life experience who could help the many children who are in need of foster carers.
Because that is the problem, right? We have a declining foster care population, right? And we have an aging foster carer population, right?
Well, that is the other issue. I think the average age is up in the 50s now, and increasingly difficult for younger people to have the accommodation, the lack of a guaranteed extra income, very difficult for youngsters to get into offering their services as a foster carer. So certainly that does compound the problem.
One of the arguments you're having is, or you just said as well, is lots of them have children anyway. So what's the hesitation there then in just having disabled foster carers?
Yeah, Becki might have a view on that, having brought up a son to adulthood herself.
The hesitation, you said, for agencies or local authorities to recruit disabled foster carers. Well, it's unclear, really, in my mind. Obviously, a large proportion of disabled people of the population is disabled people, nearly 20%. So it's also, a large portion of the potential working population, although disabled people are underemployed as a section of the population. But also many disabled people are also parents. So they have the same, ability to raise children as anyone else, but they have the added gift of understanding and strategies that they've developed and learned about how to get on with day-to-day life as a disabled person, which of course they can pass on to foster children. And I think we'll come on to this more, but as there is a disproportionate amount of disabled children within that pool of children who need foster homes, it seems to be, a win-win for everyone to have more disabled foster carers.
So also as a successful role model for maybe disabled foster children?
Yes, as a successful role model.
Yeah, because people have mastered problems, they have the strategies in place, and so it feels like lots that children with maybe similar disabilities could learn from, could benefit from, to have someone with a lived experience there.
Well, exactly. I think it'd be very difficult for anyone to put themselves in the place of for example, in my situation of being blind, and how you would get on day to day without any previous knowledge. So, for foster carers to take on a disabled child with an impairment or health condition that they have no understanding or experience of, and try to ensure that child has the best guidance, information and support, is very difficult. Whereas, I'm carrying around with me a very long lifetime now of strategies, tactics, tips that I've learned and gained from other blind people, from finding out the hard way, from my own life experiences. And I actually, brought up a son most of his life. I was on my own as a single parent. So, I have considerable parenting sort of skills and knowledge as well. It's difficult to argue that not utilising disabled people in the foster market is not missing out on something.
I think it's important to stress as well, Becki, that we're not just saying that disabled people should have equal opportunity to foster disabled children. Our stance would be that they should be able to foster any children, but if there are children with disabilities who are looking for role models, or perhaps somebody with a particular knowledge of a certain health impairment condition, then the fact that these people could be around the foster care workforce could only be a good thing. And I think the transferability of how they've adapted, many disabled people have to adapt their own lives to get through. The common denominator is probably that with all foster children, is probably that of discrimination, because often foster children who aren't disabled are discriminated against in certain ways, bullied by other kids, for example. And I think many disabled people whose lives are unfortunately often characterised by various shades of discrimination have those coping skills and strategies to be able to empower a child to cope if they were faced with a whole range of difficult situations. And without being too rosy tinted about it, we did hear examples in the few cases where disabled people did care for young people, whereby the foster child, who perhaps had a rather checkered history, shall we say, a very stroppy, often teenagers, I think, they took the view of, when I see what you have to cope with day to day in terms of your disability, it makes me really reflect on my own business, on my own behaviours and really what I've got going for me. So without being too, rosy tinted, as I say, about it, there's no doubt that positive models of disabled people and seeing how they cope with day-to-day challenges can be a really good role model for children, all children, and a chance to see a disabled adult in a positive role, i.e. as a foster carer.
Your study thought to change this, right? Or to first of all, look into the issue of foster care recruitment, and also kind of change it for the better. So could you tell me about your study? So what was the design, maybe, to start with?
We started by writing to 500 or so foster agencies in the country to see whether they were interested in letting us talk to their staff and explore any experience of engaging disabled people in their foster care pool. And we had only six agencies out of that odd 500 come back with an interest. I think many people saw it as a novelty or some wacky idea from a university somewhere that wasn't really credible, rather than in fact a common sense potential solution to their recruitment problems. Two people dropped out because of pressures of work. We then had 4 organisations from across the sectors that wanted to work with us, and we started with meeting the key staff there informally, and then we sent out a survey to all of their workers asking what their training needs, their awareness was about disability, what views they might have in general about engaging foster carers. And we then, depending on what they sent us, we customised, Becki customised primarily and delivered, as you talked about the course in a minute, a course that seemed to meet their needs in terms of what they needed to know about disabled people. And we then looked at their websites, their communication, the style, the words they used, because we also found in a study we did on the websites before the research started that hardly any foster agencies, much as they promoted different sexualities, different cultures, hardly any of those 5 ever said you could foster if you had a disability. So we looked at their material. We also had disabled people who were on our research team look at people's environments, do an audit, as it were, disability audit of their buildings, their offices, and we then did a follow-up survey at the end to establish whether, in fact, knowledge, awareness, and potential of those organisations for recruiting foster carers had in fact changed one way or the other.
And in your baseline survey, I think if I recall correctly, you asked people what they kind of know in terms of the Equality Act, for instance, right? Am I remembering that correctly?
Yeah, we asked about the Equality Act. We asked about what the barriers might be or what the positives might be, just to really set them thinking really before we didn't want to be presented like cold as here's a training course that's good for you on disability. We wanted some pre-thinking really, so that they could kind of examine their own practices and then come to the training session with at least some orientation to what the issues might be, and maybe self-questioning really about, well, why haven't we got any disabled people on our books? Yeah. So perhaps Becki, you might talk more about the Equality Act and the training kind of stuff you talked about and debated.
Yeah, of course. So I think there are some common sort of areas that people needed some help and support on. So I think it's not just about what you could or should be doing in terms of ensuring you're recruiting a diverse workforce, but it's also looking at the right side of things. So the Equality Act 2010 is the legislation that sets out how service providers and organisations should work and should enable people with a range of different characteristics to be able to access and have equal opportunity to take part in various things. So we looked at the Equality Act, which I've found through many years now of work, people's understanding and knowledge is quite low. But linked to that, of course, is also the requirement to make reasonable adjustments, what that really means in practice, what reasonable adjustments might mean when working with disabled people and a whole host of different impairments and health conditions. So understanding of that. Then I think the other side is understanding the disabled people's movement in terms of the position that most disabled people feel is appropriate is not to take a deficit model approach to looking at the potential of a disabled person to take part in work, etc., but to think of the barriers that society and your workplace and your processes and your systems and the way you do things is actually stopping disabled people from taking part. So we spent some time looking at that. I mean, we had lots of fun. It wasn't all me talking very dryly. We did group exercises and some fun things. And we looked at some case studies of people with different scenarios of people with different types of health conditions and impairments, and how the teams within the agency staff would approach that, what their initial thinking would be, how they would explore potentially ensure that there weren't unnecessary barriers or unnecessary sort of tripping points for that person as they were going through an application process to become a foster carer. I think a really important part of this as well is to just deal with all those questions that people really not sure the answers to and too embarrassed to ask. So it's all that political correct, inverted commas, issues like, what's the right language to use? How do I approach somebody? How do I avoid getting it wrong? What's the right thing to do or not do when I meet a disabled person, etc. So a lot of the training tends to revolve around that. We tend to, in this scenario, made that very much led by the workers to allow them to deal with all the, worries or concerns they might have or questions they've never asked before.
I think we had that example recently was a talk about equity and diversity, that people, I think in that case, the example was racism, and that people often shy away from asking or bringing up the topic of ethnicity or racism in conversation because they are so afraid of saying something that could be perceived as wrong. But that often has then the effect that they don't ask questions that would be important, or that they're avoiding the topic to the deficit of the other person because they, it's not acknowledged, for instance, that another person is having, for instance, racist experiences, right? Or experience of discrimination. That is similar with when we're looking at disability, that people shy away from kind of approaching the topic or asking questions because they're afraid of doing it wrong.
Yeah, absolutely. It's very much, I think it's the case with anyone I've worked with in a training environment. Generally, the fear of getting it wrong is greater than the barrier to giving it a go, if you like. So
it's always been an issue, hasn't it, Becky? But I always use the example. I worked with a guy who'd become disabled through an accident at work, and he always said to me, if I work with professionals who set an atmosphere of respect, I don't care if they get the words wrong, because they set an atmosphere in which I can challenge them appropriately and say, well, actually, that word's hurtful to me, or that word has connotations of this to me. So he says, if you can set an ambience, respect, often by just saying, well, how would you like to be known? How would I refer to you? Just as you would with people from different cultures. But I think in disability, it's been a long-standing concern. And what did surprise me in the 4 agencies we work with, one dropped out for certain reasons, not seeing it as important enough, really. It was a kind of a takeover situation, and they just thought it was not a good use of their staff's time, which is a sad comment on the whole mission that we're trying to get launched, really. But what surprised me was how few of the social workers in fostering teams had ever worked with disabled adults, because unlike when I qualified, being specialists in children or specialists in fostering, quite a significant number of the staff we met in 4 organisations had only ever worked in the field of fostering, or fostering and adoption perhaps. So they hadn't had working professional relationships with people with disabilities. And as we also know, the social workforce does also not have many disabled people in it. So the role models just weren't really there. But they were very candid about that, the staff, and said, well, we need to gen up on it. We need to be better at this, but we are uncomfortable, we are hesitant, and we are afraid of saying the wrong words and jeopardising maybe the chance of somebody following an application through. People did report that they benefited from the training in terms of their awareness, and they were very, again, frank about that. But really, it needs to be, I think, core training, core knowledge for all fostering agencies to embrace disabled people as on an equal basis as anybody who's not disabled. And that's at the moment not the case. And albeit anecdotally, we did meet several disabled people across the country who just heard about the project and got in touch with us, saying that yes, they are foster carers and they are doing okay, but nearly all of them didn't get through at the first attempt. They were not phoned back, or they had one visit, or there was some reason given which was not making reasonable adjustments. It was not a fair reason why they didn't continue with it. The current people who are foster carers in Britain, which are a very small minority, are exceptional people because they've kept going through all the knockbacks. When one agency says no, they've gone to the next one, and when that says no, they go to the next one. So they're exceptional people, but they shouldn't have to be. They should be regular people who get an equal opportunity to become foster carers. And in our experience was that wasn't the case, partly because of these hesitancies, lack of role models, as Becky's mentioned, but also because disabled people themselves who don't see role models of disabled foster carers, they also kind of think it's not for them, you know.
I suppose, because you talked about some of from the pre-survey, right? You talked about some of the hesitancy there that you identified, right? Because you did also qualitative analysis, right, of the post data then as well. If I recall correctly, wasn't one hesitancy as well whether disabled people could meet the needs of the children? That I feel like that came up in your article. Is that correct?
Yeah, it did, definitely. Yeah, it was probably more than that even, because that should be a factor with everybody we assess being a foster carer. But there were more discriminatory views, more pathologizing views of the child would become the carer of the person with the disabled person. They would not be able to snatch the child back if it was running out in front of a car, sorry. But the deficit model, I think Becki used the word deficit earlier, about what disabled people couldn't do rather than what they could do. So that was the great hesitation, and they wouldn't be able to do the medical, and they wouldn't be able to pass the first aid program, and they wouldn't be. The best one I thought was, or the worst one, well, they couldn't come to our training because the training room is upstairs in our office. You know, absolutely brick wall thinking, really. But clearly we're not saying that, you know, disabled people should be assessed to some lesser standard. Where they need to be able to put the interest of the child are paramount, aren't they, under the Children's Act? They need to be, but with careful matching, and you wouldn't place a busy couple of toddlers with a person who had limited mobility. But as we found from the people who contacted us during the course, and from the one or two people who were disabled for the organisations that came forward, the foster carers, they gave brilliant examples of how the matching, the key in the matching, that, you know, I wouldn't be any good with toddlers, but I can care for babies and I can care for teenagers. Another example we had was where a couple had been approved. The wife had a long-term condition that meant she had very difficulty with fine motor movement. She couldn't dress herself. She couldn't do buttons. She needed some help with personal care, which her husband provided. But she was the driver. She was the one who did all the paperwork, the computer work. The husband was the one who did the football and the run and the more physical side of care. And so between them, they were a great team. And, you know, all credit to the agency who's approved them and who say they're equally as good as any of our foster carers. They have special things that they deal with. They do it in a special way, and no complaints at all. And we had several examples like that, but they were very rare examples to prove that although we do have disabilities of different shades. Another good example, a lady who went blind, she lost her sight. She was already a foster carer. And so she changed from, again, caring for children of all backgrounds to specialise in either babies or indeed teenagers, a bit like the example I gave before. And the agency rolled with her on that. Rather than say, oh, you're now partially sighted, you can't foster, it's too dangerous. What would we do if a child got hurt or injured or run over? The insurers wouldn't wear it, all kinds of things like that. Whereas a professional agency, a person-centred agency, a child-centred agency would look at the advantages. What could this person offer to fostering? And more commonly, we just saw that they didn't get a call back. They never got on the pitch, as it were.
So it's quite a problem of kind of stereotypes, right? Being held and maybe ableist views. And I think maybe also forgetting that the population of disabled people is a very diverse population in itself, right?
Correct. Yeah. Oh, Becki might answer this better than me, but what do you think of the stereotype that people held, the fostering staff held about what a disabled person might, what end of the spectrum do you think they envisaged?
You know, that one comment still really sticks with me that you said, Peter, because it was quite shocking. And it wasn't just one person in one agency who made it as a concern that children would end up caring for the disabled person. And this sort of idea that all disabled people receive care of any sort, but need day-to-day care as well. So of course some people do, but there's an awful lot of people disabled who manage their own care. They're not relying on somebody else, either because there isn't anyone else or because they are independent and want to live independently and look after themselves, or that they can actually manage all their own care and they don't need to ask somebody else. And that surprised me, I have to say. A very narrow view. Almost it felt like of somebody who, you know, was in bed a lot, or if they weren't in bed, they were, you know, in a wheelchair or sitting in a chair. Very limited idea, I think. I mean, it was interesting in its own right for them to be trained by a blind person, and it was more than one person who said, "Oh, you know, are you doing the training?" I said, "Yes, I am." You know, is that an issue? And that alone changed perceptions.
Maybe talking about changing perception, because obviously you didn't just do a baseline survey, you also did a survey after the training that you analysed. And did it make a difference?
Unfortunately, one of the disappointing sides of the research was, I think we had 63 people fill in the initial survey, and then after the training, some 6 or 9 months afterwards, only 19 filled in the survey. Now, and I'm not really sure why that was, other than perhaps the excitement had gone. You know, the work had been done. It wasn't as if we were coming there the next week after they'd filled the survey in to do the training. So I think just people's busy lives, people get sick of surveys, don't they? But that was a 2/3 dropout, really. But I'd say 90% of that feedback in the 19 people who bothered to fill in the survey was, we've learnt more, we understand now, we've got a different view of disability, we understand that the medical and the first aids are their recommendations, and there's ways of getting around having to do the full first aid course. You know, the most important thing is to be able to know when to ring 999 or what have you. Different degrees, a more sophisticated view of disability, and some stated intentions to change their marketing, their approach, their websites to profile the few people that the agency had who were disabled. So lots of good intentions. Still one or two who came back to they wouldn't be able to meet the needs of the child in a fairly blanket way. That may have been the way the survey was couched, but I'd say maybe 17 out of the 19 surveys that came back were all really saying, we've learned a lot here, we've missed a trick here, we will we're obviously more educated, we're more confident. And 2 of the agencies that we know of did actually follow through and run campaigns targeted specifically on disabled people. But unfortunately, they did not get a great take-up, because I think it's still a big leap for disabled people to think that they could play a part in fostering. So there's more work to be done on that. And I think another element around that is that we had a poor response from organisations we approached who work with deaf and disabled people. And I think in retrospect, and again, Becki, you have a view on this, I think probably the most people who attend those more formal disabled groups are older people, without being ageist as an old guy myself. And really we're looking perhaps for younger disabled people to come forward. And we did have a few views on that, didn't we, Becki, in terms of looking to the future?
it's a very sweeping statement, but I think it might be that some of the groups are favoured by older people who have, got time available to spend, whereas younger people might be more engaged in sports and leisure activities. So myself, I mix my time between various sporting activities with and without other disabled people, and I felt it might be good to try to target a slightly younger profile of people through groups that are designed for people to take part in sports as disabled people, or to take part in other types of leisure activities as disabled people. Because the advantage there being they're people who are already active and out and about, and might be, more interested, perhaps. I mean, it's just one of many thoughts, wasn't it?
Yeah.
But I think it's partly to do with our welfare benefits system as well. So we did, as an additional effort, write to the Minister for Disabled People. I have a meeting with the Department for Work and Pensions to address issues around access to work payments, for example, which are payments made to disabled people to support them with support work and equipment if they are working, and whether foster carers could apply to access to work to get necessary equipment so they could complete this, quite a heavy administrational burden with foster caring, as well as a practical day-to-day burden. Or get a support worker driver, for example. And actually, there was no clear yes, no, not even the Department for Work or Pensions was absolutely sure whether they should or could not get a grant or access to work. So that they were taking that away to clarify that. And I think they felt that should be clarified so that it was available, to make it a work role in the same way that many other things are. So I think it's a host of things, and I think it's part of the rhetoric around disabled people and welfare benefits, and the idea that people are fearful if they're dependent on welfare to survive financially, that they may be impacted. So I think there is more to be done in terms of education on both sides, really.
So some definitely positive outcomes, right? So the ones who completed the survey, positive change in views as it seemed. Then some foster care agencies actually did run a campaign, but then also through that you kind of saw there's also some work to be done on the kind of other side. So kind of reassurance maybe of disabled people of some questions that are around finances, for instance, but also kind of encouragement that it's something you could do, or also targeting different demographic groups. Is that correct? That's what I've heard.
Yeah, absolutely. And I mean, we shouldn't knock ourselves in terms of what we did achieve, because I think everyone who took part, each of the agencies who took part, made physical changes to their communications, to their websites, to their processes. So in terms of, how effective it was in the places that we worked with, because we didn't just do training, we did audits of their websites, their information packs, the way they were presented. I know at least one of them produced an information pack that was just in text, that without all the glossy pictures and difficult fonts and colours, so that it could be distributed that way to people. So there were a lot of what I would call adjustments made, which weren't expensive at all. And one of the key things that we tackled was the use of fit and healthy as a term used, I think, by all agencies to describe what a foster carer needed to be, which is an assumption that, all foster carers are fit and healthy. And that's probably not totally true. I'll hand that one to Peter.
Yeah, we suggested different wordage, didn't we? Because who's fit, who's healthy, who's listening to this podcast, who would class themselves as fit and healthy, but they could probably be blooming good foster carers, So if you were a wheelchair user, we did meet one wheelchair user who was caring for 2 children, one of whom was destined for specialist residential care before she took it on. And she wouldn't describe herself as fit and healthy because she doesn't do enough exercise, but she's a wheelchair user. And she gets around after these children. She lives in a city with good public transport. She attends all the meetings. She's at the nativity play and a sports day. She's as active as any other foster carer, but she didn't like the wording fit and healthy because she says, well, I haven't got any diseases or whatever, so I'm not healthy, but I am a wheelchair user. I had an accident in her case again, and so I'm not what I would as a younger person see as a fit and healthy person, but I'm a blooming good foster carer, and she's proved it. But she unfortunately is a rarity and a novelty, and she shouldn't be. There should be people with significant disabilities and lesser disabilities in every foster agency in the land. And sometimes it's just that first, you look at a website. Most people now want to foster. Look at a website, and if the first thing you see is smiling couples, maybe these days of different ethnicities, and there'll be something written about different sexual orientations and whatnot. You then see fit and healthy, and you don't see a mention of the word disabled. People are welcome. You are going to be a special person to then ring the agency up. That barrier is immediately there, and just some of those simple changes could make a big difference. But as Becki said, we did do good. I think we changed opinions in 3 agencies, or 3.5, because say one dropped out. But there are 500 odd agencies in the land. I think there's reckoned to be a 6,000 shortage of appropriate foster care placements across the land. It needs a national policy change to really bring about a sea change in this exclusion of disabled people from being foster carers, because that's the de facto at the moment.
And I guess in a way similar, not similar changes, but big changes have been made over time, right? So I think at first it was kind of heterosexual couples that could adopt, and then it was open to single adopters. It was open to people from the LGBTQ community, and representation on websites have gotten much better with that regard, right? So just kind of highlighting that these types of changes that are needed are possible, but they just need people obviously advocating for it, right? And then having people who are actually willing to make the change. And I think actually that the trouble you had in engaging agency in this type of research is telling in a way as well, right? So that there's quite a lot of educational work necessary in order to show, but this is important. Also, this could be a win-win situation and could solve a problem that all foster care agencies are facing.
Policymakers, the DWP, Core and Bath produced a practice guide on this. Nobody we've met in sort of senior positions has ever suggested that this isn't a good way to go. Most people have said, well, you're right, you're dead right, you may have hit on something here. Why don't we do this? So I'll look into it. Well, lots of people look into lots of things, but nothing ever happens, and for all the interest we did have, and we had good interest in the project, and we were on Women's Hour even with it, reaching a national audience, and I was kind of waiting for the phone calls and the flood of people to come forward and say, this is great, can we have your advice, can we? But it didn't happen. It's happened incrementally here and there perhaps, but really our research hasn't had the impact we hope it would have had in the short term. We hope now that we've got a podcast, we've now got an academic article with adoption and fostering. These will all help, but it really needs champions. It needs people who are heads of agencies, and it needs politicians to say, look, this should happen. We met Ofsted as well, and Ofsted were very positive and thinking, well, you're dead right, we should be looking at this, we should look for a more diverse workforce, and it shouldn't be exclusionary. The national minimum standards say that assessment should be without prejudice. Well, if you don't get a call back because you've told somebody on the phone at X and Y agency that you've got a disability, then that is not a fair and unprejudiced assessment. So it does need macro change. And much as we'd be interested to do more research, we'd like to follow applicants through in a big agency, say over a 2-year period, from first phone call through to did they convert to a foster carer and are they doing well, or did they fall at the first, second, third, fourth hurdle, and what was that hurdle? We would like to do some stuff like that, but it needs political backing, really, either from the politics of local agencies or commissioners, indeed, or maybe be more enshrined in the areas that Ofsted inspect, which is a more stick approach than a carrot approach. But it is a great loss. It's a great lost opportunity to fostering to children, to agencies who are struggling, and to give disabled people valued work roles.
So if some of the listeners, who might work for a foster care agency, kind of have an aha moment and think, oh, this is something we need, and how would they go about it? Could they contact you, for instance?
Of course, yeah. Any time of the day or night. I would love to have phone calls about this, inquiries, and we'd give some advice, and we could come and do a talk, or we could, whatever we'd do to make it real rather than just a great idea, an interesting idea. It's a core solution to many of the problems faced by individual agencies and by the whole world of fostering. So we're more than happy to spend more time on this. I would very much want this to be a cultural change rather than just an interesting piece of research. It deserves, I think, even if we hadn't done it, if you'd have done it, Dennis, this deserves to be operationalized on a national basis.
And I thought maybe with an eye on time, I was thinking maybe to close, just because Becki, you were giving some examples from exercises and things done in the training, and I was wondering, what would you say was the maybe or one of the biggest things where people went, oh, I'm surprised by that, or I didn't realize that. So where you felt like this was one of the examples that wasn't really on people's radar and kind of opened their eyes to this type of the opportunity, maybe if there is a single example or one of the examples, maybe if there's multiple ones.
Oh, that's difficult.
Becki, if you think about that, I'll just chip something in, really.
Yes, you chip in.
What struck me, Dennis, I was in the training session. I attended them as an observer and chipped in here and there. One person of some years' experience in a foster team said to Becki, who was leading the training, she said, well, this is all very well and good, but how could a person with a disabled person come to the training? And the room went a bit quiet. And Becki said, have you noticed anything about me? And the woman paused for a second and said, oh, well, you're blind. She said, yes. Oh, you're delivering the training, aren't you? It was just like a bizarre, surreal moment where a person who was clearly blind and announced herself as blind, partway through a training course that was delivered very professionally. And the person gave that as a reason why disabled people couldn't partake in training. It was just bizarre, really. That stayed with me anyway, Becki. Go on, you might have thought.
Yes, there are a few moments. I think the thing that causes people most confusion, and I'm not surprised, is understanding what a disabled person is and interpreting that into practical day-to-day, and not realizing that there's no classification or registered list or single place, that every welfare benefit that may include disabled people has a different definition for disabled people in it, and that it's not straightforward, but it's also a very broad and open definition. So I think it's that area that people always like, gosh, I didn't realise that, I didn't understand what it meant, the term disabled people. And that will probably continue to be the case, I expect, for many years. Because the impact of the Equality Act has, the second thing that's always, it's not surprising, but it's quite shocking, is how little well known the Equality Act is, and even less well understood in terms of how that then applies to your day-to-day work.
So I think that's a good statement, maybe, to just not be hesitant maybe to ask the question, what is disability, what means disability, and maybe questioning the narrow view someone might hold about what a disabled person is, or what stereotype people might, however, have in mind, and then making different experience. And we're going to link your contact details with the podcast. But before we maybe conclude, because I'm pretty sure people will hopefully love this episode, is any last words, but anything that you think we haven't touched on that you think we should mention?
I think a message to social work, really, social work assessors, your profession, your value base is supposed to be about being non-oppressive, and really disabled people, in our perspective, were oppressed in the system. They didn't get an equal opportunity to be foster carers, and I really do think that it behoves social workers to challenge any views from panel, from a doctor, and from the first aid deliverer to say that this person is not suitable to be a foster carer. We should be holistic in our assessment and judge people on the strengths, what they can do, their advantages, rather than their deficits. And so long as matching is done as carefully as it should be done, then there should be no more risk associated to placing a child with a disabled person or persons than they should be in placing a child with non-disabled people. That's my last words, Becki.
Yeah, I think for anyone who has doubts, just consider how many disabled people there are out there who are raising and have raised children themselves, and those children have been raised just as well, and without coming to harm in the same way other children have. So there must be some strategies that disabled people are applying to be able to do that, and those are very useful to everyone. And I think it's the idea that we recognise and role model disabled people as parents to all children, particularly those who need fostering, I think is a really powerful message.
I learned a lot today, and I hope our listeners did. So thank you very much for being here and talking about your very important research.
Thank you, Dennis. Thank you. We look forward to all the calls coming in. Yeah.
Thank you. Bye-bye.
Okay.